We are privileged, we're lucky, we're blessed to have people at LSU Health Shreveport and in the community who are dedicated to taking on challenging problems that we face and finding solutions. And this morning, we're going to announce one of those solutions, an MOU between the Council on Alcoholism and Drug Abuse and the Shreveport Police Department, who've come together on to meet a very important challenge. And what is that? It's the fact that many of the police calls that are made don't involve real police work. What they involve are matters pertaining to mental health, in particular around alcoholism and drug abuse, that are really better taken care of by people who have expertise in that area. And if that can be done, then the police can do the things that they're trained to do and that they're really expert in, which is police work. So what we have here is the Council on Alcoholism and Drug Abuse taking on that responsibility through a mobile behavioral response, leaving the police to do their work.
4.5 years ago, Lieutenant Amy Bowman reached out to our department and encouraged the beginning of a crisis response coalition to address a great need in this community. And just to give you some statistics, in 2023, there were more than 300,000 911 calls in Caddo Parish alone. And national statistics tell us that at least half of those, if not more, are for non-medical and non-criminal reasons. And so they could be potentially handled by civilian crisis supports. But until recently, we've not had that available in this community. LSU Health Shreveport has really been the platform for building a partnership.
It took many stakeholders to come together, and what you'll see is there is a memorandum of understanding, and it's going to be signed today by Shreveport Police Department and CADA. CADA is going to be the primary provider for these services. This is already in effect and is already having a positive impact on our community. I hope that today's signing will serve as a reminder of what we can achieve when the stakeholders in our community come together with a shared purpose. This is only the beginning, and I'm confident that the Northwest Louisiana Crisis Response Coalition will be a model of success for other communities to follow.
The ability for law enforcement to connect individuals in need directly with mental health professionals is a crucial step toward improving community outcomes and enhancing public safety. When individuals receive the right support early, they are less likely to encounter the justice system again, allowing law enforcement resources to be directed toward other pressing public safety matters.
Having civilian mobile crisis response teams can make all the difference. The goal is not to criminalize mental health issues, but to offer the right care at the right time. My hope is that with this new partnership, we will see more positive outcomes, more lives saved, and less risk of trauma for people already going through a difficult time.
And what we plan to do is make sure that we do the work that we are trained, educated, and should be doing in the community, but that we can allow police, the legal system, the fire and EMS, as I said, to do their work very well too. If it's not, as everyone has said, criminal or medical, then it's for us to stand in. So look forward to seeing us out there and helping you, helping the community, and all the different resources that we can bring to our communities to get better together, and let police and everyone else do their job as well.